Selamat datang diucapkan kepada Dr Hairel Anuar Selamat. Air hujan masuk tempayan, musim hujan telah bersemi. Selamat datang hadirin sekalian, semoga berkenan di tempat kami. Kuih manis di atas talam, talam indah hadiah ratu. Izinkan kami mengucapkan salam. Assalamualaikum warahmatullahi wabarakatuh. Majlis merakamkan setinggi-tinggi penghargaan di atas kehadiran Dr Hairel Anuar Selamat, SMK Agama Putrajaya, SMK Agama Kuala Lumpur, guru-guru, ibu bapa dan pelajar yang dikasihi sekalian. Selamat datang ke University of Cyberjaya, University of Choice. Tanpa membuang masa lagi, kita akan memulakan agenda pertama kita pada pagi ini, iaitu pengenalan kepada program UOC dan MBBS bersama Dr Hairel Anuar Selamat. Dengan segala hormatnya, dipersilakan.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Thank you very much to Miss Master of Ceremony, MC. First of all, Assalamualaikum warahmatullahi wabarakatuh, and also good morning to everybody, right? Okay, to the parents, to the students, okay, to the UOC team, okay, for this open day session, right? Okay, first of all, thank you very much for coming because of taking a bit of your time, right, to come to this event, right? I thank you from the deepest part of my heart, right? So, okay, so for today, I'm going to talk about this MBBS program. Okay, so my talk actually there are two parts, right? The first one is actually going to introduce to you, or maybe to tell you the importance of this medical clinical medicine careers in Malaysia. Okay, and then part number two is actually introduction of the MBBS program that is available in UOC. Right? Okay, so let's start. Because of the reason why actually I made it this way, because right now actually there are a lot of queries. I hope I make myself clear. If let's say you've got issues, you want to ask question, you may ask later on, or you may interrupt me. Okay, no problem. Okay, so the reason why actually I start my talk with this careers in clinical medicine, because of right now actually there are a lot of issues regarding doctors, right? And then the contract doctors and whatnot and whatnot. So I shall explain to you that actually medical clinical medicine is still much needed here in Malaysia, right? Even though with a lot of issues and isu di sana sini mengenai contract doctors dan sebagainya, tetapi kepentingan untuk clinical medicine masih lagi orang kata tu masih lagi diperlukan di Malaysia. Okay. Okay, so what is actually careers in medical medicine, clinical medicine? It is actually a study and practice of medicine that is founded on the direct observation of patients. Okay, jadi jika seseorang itu menjadi doktor dan juga doktor itu melibatkan pesakit, sama ada direct ataupun indirect observation, kita panggil dia sebagai clinical medicine lah, right? Okay, jadi ada apa-apa saja yang doktor yang berkenaan seperti doktor dekat hospital, dekat klinik, operation theatre, dekat lab kan, semua tu dipanggil sebagai clinical medicine, right? Okay, currently there are about 71,000 of doctors here in Malaysia. And then of course with this 71,000, it could be nampak macam banyak kan number doktor kan, tapi sebenarnya masih belum mencukupi lagi, right? Sebab WHO target di antara doktor dan juga populasi ialah sebanyak satu doktor akan menjaga sebanyak lebih kurang 400 rakyat. Okay. Tapi di Malaysia tahun 2020 number dia ialah satu doktor menjaga 454 rakyat. Jadi maknanya kita memerlukan lagi lebih kurang 85,000 doktor yang diperlukan untuk mencapai ratio ataupun nisbah 1/400 lah. Okay. Jadi disebabkan oleh ini lagi beberapa lebih kurang 85 tolak 71,000 lah. Inilah bilangan doktor yang masih diperlukan di Malaysia. Right. Jadi maknanya walaupun adanya isu dengan doktor kontrak dan sebagainya, tetapi sebenarnya bilangan doktor yang diperlukan di Malaysia masih lagi kekurangan sebenarnya, right? Jadi berapa? 85 tolak 71? kan. Okay, you all semua lagi pandai kan sebab baru lepas SPM kan. Okay, saya dah lama SPM jadi saya dah tak tahu kira-kira. Okay, right. Okay, so lebih kurang kalau cakap pasal specialist ni ada lebih kurang dalam 8,000 specialist dekat Malaysia lah. Walaupun nampak macam nombor ni macam agak tinggi, tetapi sebenarnya jumlah specialist masih lagi kekurangan. Terutama di dalam bahagian-bahagian specialist yang agak macam tak berapa popular ataupun masih lagi baru lah, right? Relatively seperti adolescent medicine, medicine yang menjaga bahagian remaja, okay, pediatric rheumatology, right, ICU specialist and forensic psychiatry lah, okay. Tetapi overall Malaysia still lacking of a specialist and also number of doctors lah, right. Jadi maknanya if let's say all of you actually want to do MBBS and doctors, and the future actually is still there, right. Okay. Right, cuma kena orang kata toughen up, okay, sebab cara belajar medicine memang agak berlainan, alright. Okay, now come. So these are the examples of other specialties and also the field of practice lah. Okay, this one actually you can Google up sebenarnya, right? Ada banyak lah, NS lah, emergency medicine lah, family medicine lah. Okay, secara training saya ialah sebagai seorang family medicine sebenarnya. Okay, family medicine specialist lah, right? Okay, and then ada beberapa lagi lah jenis-jenis specialist yang ada available dekat Malaysia ni, ataupun masih lagi kekurangan lah dekat Malaysia ni, right? Okay, seperti general surgery, cardiothoracic, urology, dan juga lain-lain lah, right? Okay, now macam mana nak jadi doktor yang specialist tu sebenarnya, right? Okay, jadi biar saya terangkan macam mana cara dia. Okay, how you are going to get there to be a specialist here in Malaysia. Okay, all actually need a lot of a process. Okay, and then this process is actually your training ground, right? So where are you going to get trained? In university. Okay, over here actually we are training students. Actually ada 3 saja kita punya objektif yang utama. Nombor 1 ialah kepandaian daripada segi pemikiran, kognitif punya skills. Nombor 2 ialah kepandaian daripada segi motor skills, maknanya kepandaian you punya tangan, nak ambil darah orang, nak set line kan, nak buat surgery yang ni, surgery tu. And then yang nombor 3 ialah kepandaian ataupun kebagusan kita punya affective domain. Okay, affective domain itu ialah secara amnya ialah sikap ataupun attitude. Okay, jadi kita akan train you all semua untuk menjadi kecemerlang dalam 3 perkara ni. Nombor 1 ialah kepandaian pemikiran, kepandaian motor dan juga kebagusan sahsiah, okay, ataupun affective domain lah, right? Okay, so all these things actually kepandaian nak develop, kepandaian nak polish up semua sekali ni memerlukan proses. Seperti mana kita proses menjadi seekor rama-rama kan. Jadi mula-mula dia telur, dan jadi larva, dan jadi pupa, dan kemudian barulah jadi rama-rama yang cantik. Okay? Jadi all these things memerlukan proses. Sama juga proses macam mana nak develop seseorang student daripada lepasan SPM untuk menjadi seorang doktor. Dia memerlukan proses yang lama dan juga memerlukan banyak pengorbanan. Okay? Okay, so daripada segi stepnya untuk nak jadi seorang doktor, these are the steps actually that you need to take daripada SPM, okay, macam adik-adik sekarang kan, daripada SPM, adik-adik pula anak-anak kan, okay, daripada SPM, okay, then after that kena masuk A-levels ataupun foundation, okay, then daripada foundation kalau result cemerlang akan join medical school. Okay, right, daripada medical school 5 tahun join housemanship. Okay, this is dekat school, hospital lah. Housemanship sekarang ni lebih kurang 2 tahun. Dan lepas housemanship, then jadi medical officer. Dan daripada medical officer boleh berminat untuk join postgrad punya studies. Okay, postgrad punya studies ni ialah program-program lepasan ijazah. This is actually where you're going to be trained as a specialist. Dan lepas tu dah pass prograd dan kemudian join gazettement. Gazettement ni ialah macam orang kata tu proses untuk register semua lepasan-lepasan postgrad exam ni, register untuk jadi specialist dan barulah jadi registered specialist dekat Malaysia. Okay, ada beberapa proses ni kan. Tapi kalau kat sini kita up to the level of this lah. Okay, jadi semua ni memang memerlukan masa dan juga benda yang macam saya cakapkan tadi lah, right? Okay, nampak macam banyak dan juga lama kan, tapi tak apa, memang lama pun sebenarnya, right? Okay, so seperti contoh A-levels, setengah tempat ada buat 2 tahun, setengah tempat ada buat 1 tahun kan. Okay, dan kemudian tu join medical school selama 5 tahun. Okay, jadi kalau macam yang lain-lain kan, engineering ke kan, dia lebih kurang dalam 4 tahun lah. Tapi medical school memang 5 tahun punya. Right? Dekat Malaysia semua medical school akan mengalami 5 tahun punya proses lah. Okay? Dan lepas tu houseman 2 tahun, medical officer another 4 tahun. Lepas ni baru boleh join postgraduate. Postgraduate another 4 tahun. Gazetteman 1 tahun. Dan kemudian tu baru jadi NSR specialist under NSR lah, National Specialist Register. Okay. Walaupun tempat dia punya step macam bertahun-tahun kan, tapi sebenarnya semua ni memang diperlukan dan juga akan orang kata develop untuk student tu daripada lepasan-lepasan SPM macam anak-anak semua untuk menjadi seorang specialist. Okay. Memang memerlukan masa yang lama. Alright. Okay. Now, adakah dia lebih kurang 17 tahun? Tapi adakah dia berbaloi? Memang berbaloi dan memang diperlukan, right? Because sebab nak jadi specialist tu bukannya satu perkara yang senang, okay? Dan juga kita akan deal dengan nyawa dan juga kesihatan pesakit kan. Jadi kalau boleh tu memang tak boleh buat apa-apa kesilapan lah. Sebab apa-apa kesilapan daripada seorang doktor akan menyebabkan kehilangan nyawa ataupun permanent damage kepada pesakit, okay? Dan juga apabila kehilangan nyawa, kita tak boleh ganti kan. Kalau macam let's say lah doktor buat silap kan, pesakit meninggal. Jadi bila pesakit meninggal, mungkin pesakit tu akan meninggalkan anak yang kecil kan, ataupun mungkin mak kepada seorang anak yang kecil akan hilang. Those kind of things lah, right? Jadi kena betul-betul buat kerja, right? Okay. Dan juga medical field sebenarnya ialah progressive field, okay, di mana semua dia punya orang kata tu practitioners kan mesti belajar sepanjang tahun sampai tul. Okay. Sebab masa saya sekolah dulu once upon a time COVID ni semua tak ada. Tapi lepas tu bila COVID dah ada, saya kena pergi update saya punya knowledge on COVID. Dan kemudian tu now monkeypox, dan kemudian tu ini, dan kemudian tu itu. Jadi walaupun saya ni dah agak berumur, kena juga study, masih juga perlu study. Okay? Sebab medical field ialah satu medical yang progressively menjadi semakin susah lah. Okay? Jadi dia memang orang kata tu macam memerlukan banyak pengorbanan daripada kita. Okay? Tetapi dia punya, kalau let's say kita memang berminat, if let's say we are passionate about it, then insyaAllah kita akan dapat buat lah. Okay. Okay. And then kemudian tu kita akan only improve by updating our knowledge and also mengembangkan kita punya experience lah. Jadi lagi banyak kita punya experience ada, kita akan menjadi doktor yang lebih matang dan juga lebih berpengetahuan. Okay. Jadi sebab itulah kena belajar. Tapi walau macam mana pun, janganlah terasa macam ni panjang sangatlah 17 tahun, banyak perkara yang boleh dibuat, right? Sebab memang apa tu nama dia, memang orang kata tu masa tu akan menyebabkan kita mengalami, dan mengalami tu sebenarnya akan menyebabkan kita lebih kaya daripada segi experience. Okay? Sebab doktor ni dia sebenarnya kalau lebih experience, lebih banyak knowledge, lagi baguslah yang mereka akan jadilah, right? So it is actually need a lot of what they call it, sacrifice, okay? And then you need to know what you're getting into lah, right? Okay, jadi bila lagi banyak experience, the more experience that you have, the more knowledge that you have, we will become better doctors, right? Okay. Okay, and then it will eventually end lah. Okay, dia punya studies kan, dia punya orang kata tu, and kemudian tu bila kita dapat jadi specialist tu, kita akan jadi rasa macam orang kata tu macam berpuas hati dengan apa yang kita dah capai lah, right? Okay. Postgraduate courses, macam saya cakap tadi kan, after actually certain doctors have already settled their housemanship, join MO-ship kan, then after that they want to go into postgraduate, they can enroll in a public universities or you can go into private pathways lah. Okay, this thing actually is a bit of a bit future lah untuk anak-anak semua tu mungkin agak susah, macam tak berapa relevant lah because this one actually is for postgraduate punya studies. Okay, walau bagaimanapun, I'm just going to explain to you on the surface lah here in Malaysia, right? So even though walaupun nampak macam ada banyak masalah isu daripada segi doktor-doktor tak mendapat kontrak daripada kerajaan semua sekali kan, nampak macam bilangan doktor terlalu ramai. Tapi sebenarnya based on the data yang saya dah ceritakan tadi tu, memang Malaysia masih lagi memerlukan bilangan-bilangan doktor. dekat dalam dia punya servis. Okay? Banyak lagi kan, tadi kan 85 tolak 71,000. So itulah jumlah doktor-doktor yang akan diperlukan oleh kerajaan Malaysia buat masa ni. Okay? Dan lepas jadi doktor boleh teruskan pengajian untuk ambil specialist. Okay? Tetapi walaupun masa banyak diperlukan, tetapi dia memang berbaloi in the end. Okay, akhirnya memang orang kata tu worth it lah, all your time and also the sacrifice that you have. Okay, okay, now so we head to part 2. Okay, up to this level ada apa-apa soalan nak tanya? Okay. Jadi siapa-siapa nak join medicine, jangan rasa macam, oi nanti dah join medicine nanti tak ada kerja lah kan, nanti jadi doktor kontrak lah, lepas tu tak ada offer, kena berhenti kerja kan. Actually that's not the picture actually. Okay, sebab dia punya offer masih ada based on that thing. Tetapi macam mana untuk mendapatkan kontrak apabila kita dah jadi medical officers? The answer is actually macam saya cakap tadi, keperlukan 3 perkara. Yang pertama tu ialah kebagusan knowledge, yang kedua kebagusan motor skill, tangan mesti cakap buat kita punya kerja, dan yang ketiga sahsiah, attitude mesti baguslah. Di mana kalau macam kita bagus dalam 3 perkara ni, right? Semua unit, semua specialist, semua bosses akan nak kita join mereka punya team. Okay, jadi imagine kalau macam anak-anak semua ialah pemain bola sepak, tapi pemain bola sepak yang sangat bagus macam Cristiano Ronaldo satu ketika dululah sebab sekarang dia dah tak bagus kan, I'm not too sure. Okay. Okay. So kalau Cristiano Ronaldo pemain bola sepak yang bagus, semua tim nak dia main untuk tim mereka, right? Okay. Jadi adalah ibarat macam kita ialah doktor yang bagus, semua tim tak kisahlah apa tu surgery ke, mata ke, apa tu nama dia forensik ke, akan nakkan kita join team mereka, right? Jadi kita kena bagus. Macam mana nak dapatkan kebagusan tu? Di sini kita akan train kita punya student untuk jadi untuk orang kata tu mendapatkan kecemerlangan dalam 3 topik ni, okay? Iaitu kecemerlangan pemikiran, kepandaian, kecemerlangan motor dan juga kecemerlangan sahsiah diri, okay? Ataupun kita punya attitude, sikap, right? Okay, right, okay. Now come. So kita go to the part 2. Boleh pergi? Okey. Right. Jadi di dalam part 2 ini saya akan ceritakan apa yang kita buat dekat University of Cyberjaya dalam orang kata tu mengajar ataupun mendidik bakal-bakal doktor. Right? Okay. Okay, thank you very much. Okay, so this is actually Cyberjaya. Okay, this is actually the full address and also number contact and also website lah. Okay, since you already here, I don't really have to show the picture of a Cyberjaya University lah. Okay, you can go and tour later on, right? Okay, this is actually our team, the faculty. Okay, dia punya, there is actually a dean. Okay, the dean actually is a Major General Professor Datuk Dr. Muhammad Zain Bidin. Okay, Deputy Dean of Academy, Dr. Rafida. Okay, Deputy Dean of Student Affairs, me myself. Deputy Dean of Administration, Postgraduate and also General Studies, Associate Professor Dr. Satapan Subramaniam. Okay. So as you can see, we are all very well structured over here with our dean and also the deputy deans, and also this is actually the head of a division, right? Okay. And then this is actually coordinators, right? So the structure of the university actually is very well structured, okay? And then we do have our, what they call it, the carta organisasi dan juga dia punya, what they call it, dia punya TOR lah. TOR lah, terms of reference ataupun tugas-tugasan mereka ini. Mereka semua memang very well structured, okay? Dan pada waktu ni memang kita, our MBBS program memang mendapatkan pengesahan daripada MQA lah, right? MQA ialah Malaysian Quality Agency, right? Di mana if let's say you were to be good, your program, the MQA actually will give you a green light. So all the graduates from our medical university can go into working life later on, right? Macam kata tu macam the program actually tu macam sah lah. Kalau tak dan mendapat MQA, program tu sebenarnya tak sah. Kalau program tak sah, you may study, you may get the certificate, but your certificate is actually has got no values, which is actually no good lah. Okay, right? Okay, so this is actually the coordinators, like I said to you just now. This is the history lah. Actually, you can read up this one actually in the website. Okay, first of all, we were developed in a very short, very small college university once upon a time. Now, Alhamdulillah, we are already a full-fledged university. Okay, so this is actually our main campus lah. Okay. Okay, this is actually the vision of the faculty. Okay, like what I said to you just now, we want the students to be good, okay, and competent medical and also healthcare professionals later on. Okay, up to the level of international repute lah. Right? So this is actually the vision, and this is actually the mission. You don't really have to read so much lah, huh? And also I do not want to bore you with these things lah. Okay, all right. So this is actually our mode of teaching the students. Okay, our syllabus is actually a spiral curriculum punya type of a syllabus. Okay, in which initially year 1 is like this. Okay, lagi menjadi semakin dewasa, year 2, year 3, year 4, year 5 kan, dia punya tahap kesusahan semakin tinggi, tetapi dia punya tahap master ataupun menjadi semakin bagus dalam topik tu menjadi semakin bagus lah. Okay, as opposed to the traditional ones. Sekarang kan banyak medical school internationally even dia dah tak buat secara traditional. Traditional ni macam very tak berapa orang kata tu macam you can they don't really develop the critical thinking lah, right? So that is actually traditional. Traditional meaning that study is study, pesakit is pesakit. So nanti later on student tu tak boleh nak connect apa yang dia study dengan pesakit yang datang, right? So that is actually the traditional way of medical school. But overall, everybody, most of the medical school in the world have already gone into this spiral curriculum, okay, in which they will orang kata tu macam ajar student berkenaan dengan perkara-perkara yang relevan kepada pesakit, alright, develop dia orang punya critical thinking, okay, and then also bagi dia orang banyak problem-problem yang berkaitan dengan pesakit, so mereka akan tahu macam mana cara nak relate belajar dengan pesakit yang akan datang, right? This one actually tu we start to give them this problem based learning everything as early as year 1. Right? Daripada year 1 lagi kita dah cakap, okay, this is pesakit and this is your knowledge. Macam mana nak kaitkan mereka, right? So this is actually what spiral curriculum is all about lah. Okay. Okay, so this is actually the structure. Macam tadi saya cakap ada 5 tahun kan. So this is actually the structure. Year 1, year 2, year 3, year 4, year 5. Di mana year 1 and year 2 belajar dekat kampus, okay, dan juga dia punya topik pembelajaran adalah seperti ini, anatomy, psikologi, okay, dan lain-lain. And then year 2, system, cardiovascular system, hematology system, respiratory system and lain-lain, okay. Tapi cara belajar dia ialah cara lecture dan juga lab, okay, dan juga what they call it, assignment, presentation and whatnot lah. Alright, so this is actually year 1 and year 2. Okay, so if let's say you were to pass all these postings, you were to pass all these blocks, okay, then you can upgrade yourself to year 2. Okay, but this is preclinical. So before you go into clinical, you need to take one of a professional exam. Okay, this professional exam consists of all these things, Then you take the professional exam. If you were to pass this professional exam, then only you can upgrade yourself to year 3. And then year 3 is actually the clinical years. Year 4 clinical, year 5 also clinical. So this is actually where the fun starts. Fun meaning that this is where you are going to be posted in hospitals and clinics, and then you will see real patients, and you will get to do the teaching at the hospital, do the teaching at the clinic, and then you get the chance to do all the things actually that the doctor do lah. Okay, meaning that you can go into operation theatre, you can do blood investigation, you can see real patient, you can talk to real patients. Okay, so this is where the fun starts lah. Okay, in which this one pun actually fun juga sebenarnya, right? But it's a bit like macam very tak ada jumpa pesakit, okay, belajar dekat campus, dan belajar dekat lab, dan belajar dekat lecture halls, right? So this is year 1 and year 2. So after you graduated with your professional exam, you go to year 3 where the fun starts. Then you take the exam, pass all the postings, you go to year 4 Okay, study, take the exam, pass all the posting. You go to year 5. So year 5 actually is like basic junior medical, housemanship at the hospital. Okay, you take all the exam, you pass all these exams. Then before you graduate, there is actually another professional exam here. Okay, the professional exam is called as a professional exam 2. Just now actually professional exam 1, then you take professional exam 2. If you were to pass this professional exam 2, then only you'll be graduated as medical doctors. Right? Yeah. Interesting, kan? Alright. Okay. So where are you going to study this? You're going to study this here in this campus. Okay, the lecture halls, the labs, okay, and also the what they call it, the bilik mayat and whatnot, right? Okay. Okay. But the moment you go into clinical years, your life will be very more interesting because of over here, you will go to all the hospital, the teaching hospitals, and then we're going to post you there, right? And then you can talk to real patients, you can touch them, okay? You can practice whatever it is that you've already learned from here, all right? But remember, you need to take one exam here and then one exam here, then only you graduate as medical doctors, okay? Boleh. Mhm. Mhm. You want 2 semester? Mhm. You want?
In this case, in this university,
Mhm.
dia ada macam mana dia sama
Okay.
juga kan berbeza.
Oh, bukan. Okay, okay, terima kasih atas soalan yang ditanya. Tetapi apa yang saya cakap tadi kan, dia ada banyak blok kat sini. Di mana kalau macam setengah-setengah blok tu kegagalan, okay, apa yang perlu dibuat ialah repeat apa ni nama dia, exam untuk blok yang gagal tu. Tapi dia punya masa repeat ni ialah di hujung semester. Because this one actually kita tak ada exam hujung semester, Okay. Kalau preclinical kita tak ada buat macam tu lah. Tapi kalau clinical kita ada buat exam hujung semester. Di mana kalau macam ni field, let's say contoh field anatomy. Okay. Tapi apa yang kita buat ialah sebelum naik ke year 2, repeat lagi sekali general anatomy punya exam untuk pass. Kalau pass boleh naik to year 2. Kalau tak pass dan kemudian tu kita tengok lagi berapa posting yang fail, mungkin akan duduk year 1 lagi sekali. Bukannya maknanya fail saja satu blok, kena duduk year 1 automatically. Kita bagi chance untuk ambil receipt exam. Tapi receipt exam itu hanya blok yang fail sahaja. Right? Clinical years, usually dia punya exam ialah hujung semester, tapi biasanya kita kumpul lah. Contoh lebih kurang macam year 4 kan, orthopedic and also forensic satu exam. Tapi kalau let's say fail exam, contoh orthopedic fail. Apa yang kita buat ialah bagi ambil receipt exam orthopedic saja. Kalau pass boleh naik year 5. Kalau tak pass retain year 4. Maknanya kalau macam posting yang dah pass, kita tak akan suruh ambil exam lagi lah. Contoh exam tu ialah orthopedic and forensic. Forensic pass, orthopedic fail. Ambil exam orthopedic receipt sahaja. Okay, forensic no need to ambil lah sebab dah pass lah. Kalau dah pass tak payah. Okay. Jadi sebelum nak upgrade from one year to another year, semua blok kena pass. Semua blok kena pass, semua blok kena pass, semua blok kena pass, semua blok kena pass. Right? Professional exam year 1, dia punya cover ialah the whole of the year 1 and also year 2. Okay. Exam for professional year 5, cover dia ialah the whole year 1, year 2, year 3, year 4, year 5. Okay. Right? Semua sekali. Yes, correct then. So because this one actually nak graduate jadi doktor, jadi dia punya exam tu, professional exam dia, mestilah orang kata tu macam holistic lah. Semua kena ada. Kita tak boleh tanya year 5 saja. Nanti tak fair kan. Tuan-tuan dah lupa year 1 kan. Jadi kena tanya juga. Tapi biasanya kita macam year 1, year 2 ni is preclinical and year 5 ialah clinical. Mungkin soalan preclinical ni tak berapa banyak lah. Okay. Banyak kepada clinical. Macam tadi dan saya cakap lah, problem based solving, patient come with the problems, what is actually the history, what is the physical examination, okay, blood investigation, what actually is the important ones, right? How do we manage them, right? All those things in year 5. Because after this, they're going to become doctors, and doctors' life, they need to see real patients, they need to settle all the patients' problems by themselves. So you need to be good here, right? Before we graduate you lah, okay? So this is actually the structure lah. right? Okay. Okay, now this is actually the punya tahun di mana year 1, semester 1, semester 2, year 2, semester 3, semester 4. Okay, this is preclinical lah, ataupun we call it medical phase. Medical science punya phase, preclinical. Bila masuk kepada year 3, year 4, year 5, dah jadi macam clinical, kita panggil dia sebagai clinical science lah. Year 3, semester 5 and 6, year 4, 7 and 8, year 5, 9, and also year 5, 10. Okay. So macam ni. Year 1, year 2, year 3, year 4, year 5. Then kat sini. Right? So ada satu exam professional sini. Sini pun sebenarnya ada 2 exam professional lah. One is here, the other one is here lah. Okay. Alright. So this is actually the niche curriculum of UOC. Okay, over here actually we focus so much on student-centered team-based learning. So what is a student-centered team-based learning? Okay, in this particular style, we give the students opportunity to prepare for certain topics, right, beforehand. Let's say for tomorrow, we've got a topic on CVS, apa ni, belajar jantung. So we ask a group of students to prepare that topic. Right, so they prepare and then they learn about the topic first, right? And then after that, they prepare the slides, everything. So the next day, they will come and they will present to the whole class, right? With the guidance of a lecturer. So the lecturer will be there to correct them should they make any mistakes. So meaning that before they join the class, they are already halfway prepared for that particular topic. As opposed to the normal didactic ones. Didactic meaning that, okay, lecture come, student listen. Usually when the students were to be told to do that, they won't come prepared. Okay, so if they do not come prepared, their input for that particular topic will be about maybe the most about 40-50% by the end of the session. Okay, if let's say they were to come prepared like this one, maybe when they come to the class, they are already like 40-50% prepared. After the class finish, then maybe 80 ataupun 90% will be in their heads already. So this is actually student-centered team-based learning ataupun kita panggil dia as SCTL, right? Okay, over here we champion so much into SCTL because we want the students to be actively prepared and actively in charge of the sessions. Okay, but with guidance from the lecturers, right? So we don't really have a lot of didactic so much. Didactic meaning that I give you accept, I give you accept. So that is your didactic. Okay, SCTL meaning that the students actually will give their presentation. Okay, we are moving away from the traditional didactic ones. Okay, and then this one actually is affective domain. Like I said to you just now, it is actually the development, your attitude, development of the sikap. Right? Because just now, like I said, we want doctors to be good in knowledge, we want doctors to be good in their motor skill, and also we want doctors to be good in their attitude. Okay? I'm sure if, let's say, you were to be a patient, you do not want to see a doctor who are very cocky, who do not want to listen to you, right? So, obviously, if, let's say, you see a good doctor with a good attitude, about 40-50% of your pain will be relief already. Right? So this is actually part of our niche area of the curriculum, affective domain. Talk about this affective domain. Yesterday, there was actually a camp that we conducted for year 2 students. Okay, the camp actually is meant to develop their attitude. Okay, the camp is conducted in Semenyih. Okay, it was on Friday and also yesterday it ended. Right, camp. So it's not just a simple, like I said to you, year 1, year 2 quite boring, but it's not as simple as boring as classroom. There are certain posting that we take the students out to the what they call campsite. Semenyih, as you know it, Semenyih is a bit far away, right? But actually over there we develop their what they call it, this teamwork skills. Okay, we develop their apa ni nama dia, ketepatan masa. We develop their kata tu dia orang punya effective domain lah, the sasiah lah, right? Okay, so not only knowledge only, right? Okay, and then we do have Yang Mercy and also Watania here, right? Yang Mercy is actually part of a Mercy Malaysia. Okay, in which if we have some kind of things, let's say once upon a time, there was actually earthquake in Aceh, we even send students there under Mercy Malaysia. Okay, but because of this is actually undergrad student, so it's called as a Young Mercy lah. But it is actually directly under Mercy Malaysia. Okay. But unfortunately, because of this COVID and also because of the a lot of restriction, MCO and whatnot. So the activity of a young mercy is a bit put on hold right now. Okay. So whatever it is, now baru jadi endemic balik. So mungkin these activities is going to get reactivated balik lah, right? Yang mesti watania actually is like askar simpanan lah, right? Okay, we do have it here as well. Okay, and then we do have military medicine and also DRM. They call it DRM lah, Disaster Preparedness and Relief Medicine Training. Okay, this is actually from year 1 until year 4. Okay, year 1 and year 2 they give theory, and then for year 4, if I'm not mistaken, they will take these students to military camp, and then they will like macam buat pura-pura punya what they call disaster lah, right? The students actually like it very much lah. Okay, because of activity outdoor kan, macam pura-pura. Sometimes tu they buat macam ada kapal terbang jatuh terhempas with a lot of casualties. Okay, how you are going to develop it? Okay, kadang-kadang tu macam anything lah, right? So this is actually part of the thing that we do have here. Okay. Right, and then we do have Tahfiz program lah. This is actually collaboration with the Darul Quran Jakim and also Mara lah. Right? Okay. Okay, so this is actually the number of students that we have here. This one actually is not really updated one lah, because of we have already merged with AMU later on. So the number actually dah jadi berubah lah. But whatever it is, we have already graduated a large number of doctors here in Malaysia, right? And some of them actually have become specialists, qualified specialists lah, right? Okay, maybe the first few batches lah, because they're senior kan, so they become specialists already. Then the younger ones still waiting for their turn to be absorbed into the training processes under specialist program, right? Okay, so a total number, yeah. Intake. Yeah. Okay. Right now, we have already mendapat kelulusan daripada pihak MQA untuk mengambil maksimum sebanyak 210 student satu batch. Right. Dulu dia jadi 150, mula-mula 100, then naik jadi 120, then naik jadi 130, and latest one dia benarkan kami untuk ambil up to 210 student per intake. Right. Okay. Okay. Kebiasaannya chances to go into the program is very high, especially if you were to join the foundation here, right? Because of we already know you, okay, macam lebih kurang sebelah kaki dah masuk medical school macam tu kan. So in foundation you just need to score very well. So if your point were to be adequate, then we will absorb you, right? Tapi sebenarnya at the same time we are taking the students, the graduates from other group lah, like foundation, other schools, IB, and also other A levels from other schools as well, right? Okay, but everybody actually need to be assessed according to the MQA qualification lah, right? So it's not just anybody pun boleh masuk lah, right? Okay. So as you can see, the total now we have graduated about 1,523 doctors here in Malaysia. Some of them are already qualified specialists, some of them are in the program, and some of them actually just MO, and some of them actually are still housemen lah. Right? The one that actually graduated in March, we've already called into the housemanship program lah. Okay. Okay. So basically the chances of getting absorbed into the KKM is very high. We can safely say that almost 100% of our graduates are being called into the KKM site to become housemen lah. Okay, even actually for international students. So they go back to their own countries, then after that they can absorb into their countries to become housemen. Okay, so this is actually the one that I said to you just now, where the fun starts. So this is where you're going to go for your training, okay, as a teaching hospital and also community clinic hospitals lah. We send students to hospitals Cyberjaya, Kajang, Banting, all around the Klang Valley. Oh yeah, sorry. Minimum qualification. Okay. Minimum qualification to join medical school from what they call foundation, right? From the foundation is actually 5Bs or 5Bs, not all, sorry, 5Bs and also CGPA minimum 3.0. Okay, so if let's say you manage to score 5 Bs from your foundation with a 3.0 CGPA, you can join. Okay, but of course you need to interview you first, and then to see whether actually you are what they call it qualified or not lah. Right? Okay, nah, that is actually from foundation. And then it's the same. It's the same. If let's say they were to take a foundation from other university, Asasi Science, Asasi Science, UKM, USM, we do have those type of what they call candidates. So that is actually the minimum qualification lah. Because of if let's say they were to be a high scorer, usually the university will absorb them. Okay, but we do have actually students from other Asasi, not from our Asasi. Students actually score full flat 4.0 with 5 A's. Still not get accepted from their university. So they come here. So we ambil lah. Okay, after the interview process, right? Not just simply ambil macam tu. Okay, yes, Encik ada.
Kimia, fizik, maths,
Science. Ya.
Empat A, empat B1C, English ke? Boleh dipanggil tak?
Okay, if the C were to be in English, usually, what they call it, if let's say the criteria actually is not adequate for our entry, usually we will ask the candidates and also the parents to write to the KPT. KPT is the Kementerian Pengajian Tinggi for them to give their approval. If they approve, then we can take. Because we do not want to take this type of candidates and then study, and then later on they cannot be absorbed into the program. Program meaning that the KKM side lah, and then the parents actually will blame us. So we do not want that to happen. We will say, if let's say your criteria were to be a bit lowish, but it's there, you want to join, you write to KPT. The moment KPT give you the green light, we can accept. Because whatever it is later on, we can always blame on the KPT. Right? So usually we do not want to take any so-called risky activities ourselves, because later on nanti kena saman susah. Right? Okay. As you heard, a lot of university actually get saman kan, Lim Kok Wing lah, all those things. So we do not want that kind of a thing. Right? It's a bit messy if you were to get into that. The best is actually you join, you score, you study hard, you score, good cognitive, good motor, good attitude. We will absorb you into the program, MBBS program. You study some more, you score, you become doctors, you study some more with a good background, everything, you can be trained into to be a specialist later on. Okay, because the seat for the specialist, the seat for the doctors is still empty, like I said to you earlier, right? So, okay, right. So this is actually the hospital, teaching hospitals. Unfortunately, because of we do not really have our teaching hospitals on our own, so we have got still use the KKM hospital, the KKM they call community clinics lah, to teach our students, right? So for year 3, usually you need to travel. You need to travel to Alor Gajah, Melaka, Sri Manjung, Perak, right? And maybe Johor Hospital Muar and also Hospital Batu Pahat lah. Right? Because of we are still using the KKM site for teaching purposes, right? But if let's say you were to go to year 5 and we want them to study hard for their exams, we confine them to the Klang Valley Hospital, right? So it's like that lah. So year 3, year 4, traveling here and there, then year 5, Klang Valley. Okay, so it doesn't mean that actually year 4 and year 3 doesn't have Klang Valley Hospital lah. They do have, right? But there is actually a chance for you to be posted elsewhere, right? Usually the students like this outside kind of what they call it, environment lah, right? And then community clinics, we do have Sepang lah, Dengkil lah, Puchong lah, Bangi lah, and the rest of the thing. Okay. Okay, so this is actually additional teaching hospitals. Okay, the one that I said to you earlier, because of we merged with AMU. Back in October, if I'm not, no, sorry, not October. Yeah, back in October, if I'm not mistaken. So we have already added this hospital, Sultanah Fatimah Muar, Hospital Sultanah Nora Ismail Batu Pahat, Klinik Kesihatan Muar, and also Johor as part as our teaching hospital, right? Okay, we are already we have been recognized internationally by Bangladesh, India Medical Council, Maldives Medical Council as well. So that's why actually if you were to come here, you will see international students as well. Okay, so it's not like just local only. okay, because of they have already recognized us. So they send their students here, okay, then the students pass, they come back to their countries, and then they can practice over there, right? Okay. Okay, and when now actually we have postgraduate programs as well, okay, but our program is actually like a PhD postgrad, and also we have already outlined our Master of Public Health, but it's not been launched yet. There's some kind of a nitty-gritty issues with the KPT, if I'm not mistaken. So because of that, actually, it's still not launched yet. But the candidates actually can always come and then do our PhD here. Okay. Okay. As for new students, we have hostels, scholarships, loans. Okay. Scholarship and loans is actually like under our university. We do have Tan Sri Palan's foundation. Okay, and also loans from the usual, what they call it, contributors lah, like PTPTN, GPAs, and whatnot, right? Okay, and then we do have lecture halls like, okay, maybe after this you can go and tour, okay, the university. Okay, we do have laboratories. Laboratories is in level 3. There are a lot of labs. Okay, but then this lab actually is being shared with the what they call it, students lah. Okay, and then we have dissection halls with cadavers as well. I'm not too sure whether actually university allow you to visit them or not. No. But if I'm in charge, I will allow you to go and have a check lah. Okay, just to expose you. Okay. Ada? Oh, boleh, okay. But I'm not the boss of the university, so don't ask me lah. Okay. Any questions? So that is actually how we structure our MBBS program. It is actually hand in hand with the KKM activity, but like I said, our MBBS program actually has got a very special niche area, okay, for our MBBS students, right? Yes. Okay.
We want to know how many students are allowed in UOC, MBBS students are we taking in for this year?
Okay, just now actually I've already explained. The question actually asking how many maximum number of students to be allowed in MBBS program. Okay, the one that actually our dear sir have already asked just now. And the answer actually is still 210. So just now actually I said 210, now pun 210. So it's still the same, 210 maximum students are allowed to enter MBBS program under UOC banner. 210. Okay, any more questions? But I'm sure if let's say you were to be joined here, right? Because of before this, I've already had opportunity to have a look at other schools, other medical schools' syllabus. I can safely say that actually our syllabus is actually one of the top syllabus for IPTS here in Malaysia. IPTS ialah Institute Pengajian Tinggi Swasta here in Malaysia. Because of the structure, because of the spiral program. If let's say I were to go back in time and then I become young again, I would want to join this university again because of the program and whatever that actually they have, right? Because I came from the old timers, so our time was very what they call it, tradition, everything, and very boring. There's no any camp, all this good camps. There's none. Right? Yes, sir.
Ini doktor mention pasal yuran kan? Yuran, saya rasa 300 lebih kan? Tapi nak tanya, macam ada program luar, kena pergi buat clinical somewhere else, accommodation, tempat lain. Adakah cover dan yuran tu, buku-buku lagi, reference books, does it cover into that particular fees tu?
Yeah. As for the fees usually covers for the hostels here. Usually the year 3, because year 3 students actually need to go to other hospitals, like hospitals Manjung and whatnot. So their fees for the lodging around there is already covered under the yuran. But if let's say they were to go to year 4 and year 5, if they want to stay here in the hostel, the fees is already included in the yuran with a bit of an additional one. But if let's say they do not want to stay in the hotel, they want to stay outside, because of in year 5, the teaching hospitals confined around KL, around Klang Valley. So some of them actually stay in Puchong, some of them stay in Cyberjaya under their own. So they do not really have to pay that extra for the hostel. Reference books, I'm not sure, but I do think actually reference book is not covered. Not covered. Yeah. Mm-hmm. fees. Reference books. Yeah, we do have libraries, and then yeah, pinjam. Approximately. Usually, I think the books are not that expensive actually. The most I think about 200 per book lah. But usually they don't really have to buy all the books by themselves because of this book actually you can borrow from the library, or actually you can get it online. Alright. So usually I can safely say about 3 to 500 ringgit per semester lah, for the books lah. Okay, yes, any more questions? Right. Okay, so alright.
Doctor.
Oh yeah, sorry. Yes, sir. Recognition.
In the event, say after the students graduate and the placement for housemanship is limited or maybe prolonged, you mentioned about Maldives, India and Bangladesh. Say for example, if they want to go elsewhere to do housemanship in the local kind of regional area, be it Thailand, Singapore, Australia or even UK, your MBBS is it recognized by the countries?
Alright. Okay, the question actually was on housemanship placement after the students actually graduated. Okay. Right. Usually this is actually the structure for Malaysian KKM style. If let's say the students were to be Malaysian, after they finish their studies, they need to go for that housemanship. After that housemanship, then only they can join their MO-ship, okay? And then during the MO-ship, then only they can get their APC. APC is the Annual Practice Certificate, right? So with this APC, they can go elsewhere. But without the APC, they cannot go and practice elsewhere, right? So meaning that to answer your question, sir, for fresh graduate, they need to be trained here in Malaysia for them to get their APC. So because of without APC, they cannot practice. Just like James Bond, without that license to kill, then they cannot kill, right? So that APC actually is given by the KKM. Once they were to get their APC, it's up to them whether they can work in Australia, they can work in Singapore, Brunei, wherever it is they want to go, then it's free for them. But they need to get trained here in Malaysia for Malaysians lah. Right. Even actually for them, international students, we do have international students, but because they are international, they are not Malaysian, they are not supposed to do their housemanship here. They need to go back to their home countries to practice as housemanship, get their APC, then only they can come back here to do their postgrad studies. Unfortunately, this is actually the system by the KKM. Right? So after they get their APC, as MO, they can practice elsewhere to places that actually recognize our MBBS. Okay, because of that one actually to answer that kind of a question, where can they go after that, depend on the rules and regulations stated by the countries. Let's say now UK, they're a bit tight because of the Brexit and whatnot, right? So they're a bit tight. Last time around, they used to accept. Now actually they're a bit tight. But for Australian, it's okay, quite easy. Singapore also quite easy. Brunei also quite easy. Indonesia, I've not heard of our medical doctors actually going there as a contract doctor. But these other places, they can. But the syarat is they must get their APC. And APC is going to be offered to them if they were to join their MO already. In housemanship, they won't be offered any APCs because they're still under Dr. Pelatih. So they are not like, what they call it, full-fledged medical officers yet. Right. Okay. Any more questions? Yes. So last, okay. So last words. Oh yeah, sorry. Yeah.
Kalau kata, since you mentioned tadi Bangladesh, India yang bagi recognition for this program, how about the UK? Adakah yang as I know macam dekat ada universiti di Malaysia yang branch campus di UK, dia boleh buat houseman di UK. So any possibility initiative from this university to have recognition from UK?
Right. Right now, actually, okay, the question actually, what about UK? All right, so UK, for usually the one that you hear, the one actually housemanship you can practice there, that is actually strictly for twinning program. Twinning program meaning that 2 years here and then 3 years over there in UK, or maybe 3 years here and then 2 years in UK. So if let's say the program is twinning program, then you can get your training over there and then you can practice over there. Unfortunately, we are locally bred, we don't have any twinning program. Alright. Yeah. Maldives, right? That's why program recognition for UK maybe in the future, but not now lah. The latest one actually we tried was Sri Lanka. Luckily, actually they did not allow it because now they are already collapsed. Sri Lanka. Okay. They rejected our application. Yes, sir. Boleh, no problem.
Tadi Dr. cakap selepas menjadi MO, jikalau anak-anak nak continue study ataupun bekerja di luar negara, Dr. cakap
Pelajar diminta untuk menghormati majlis ya. Terima kasih.
whetherkah anak-anak akan perlu go for some entrance exam for the country ataupun apa?
Exam for the
Let's say
postgrad.
selepas menjadi MO, houseman finish di Malaysia, sudah jadi MO, kemudian setelah beberapa tahun bekerja di
join.
sini, mungkin anak-anak kena belajar di luar negara, as a specialist, ataupun bekerja di sana. So adakah perlu dia mengambil entrance exam di negara itu ataupun recognize MBBS Malaysia?
Okay, the question is actually whether the students actually need to go to, first actually there are two questions. Yeah. One is actually whether they can join postgrad exams, okay, in that country, for example in UK, right? And then another one, if let's say they want to go as MO over there, do they need to go and sit for special exams? Okay, so the answer actually for question number one, if let's say they now because of there are too many candidates wanted to join the postgrad exams, so usually before they can be allowed to enter certain program, they need to sit for qualifying exams. Even actually for local masters program offered by UKM, USM, they need to sit for these qualifying exams. Okay, if let's say they are good, they scored very well in that qualifying exam, then only they are allowed to enter that program. Pardon? Okay. Right. Okay, the other countries, okay, unfortunately, not unfortunately, fortunately, the other country actually is a parallel pathway. Parallel pathway actually is not masters. If let's say parallel pathways depend on their own preference, their own preparedness. If they are prepared, they can join. And then they can sit for the exam. But this one they need to pay. They need to pay. There are 4 exams altogether. Part 1 and Part 2. Part 1 there are 2 sets. Part 1A, Part 1B. Part 2, Part 2A, Part 2B. So for them to sit for Part 1A, Part 2A, it's up to them. So there's no any, what they call it, prerequisite exams for them to take, right? So that's actually for the postgrad studies. If let's say they want to go and join as an MO, usually they can just request from that country, depend on how the country is actually, what they call it, setting the rules. Okay, like Australia, usually there's no any specific rules. They need to take exams for Australia. Even actually for Brunei, they don't need to take for exams, special exams. But they go there as MO, not as specialists lah, because they are not specialists. Depend. Okay, I've got a few friends actually going to Australia working as MOs. Brunei also working as MOs. They just simply go there, no exams. Okay, because of it's recognized, right? Recognized. Yeah. Except for the master's program, they need to sit here. But if let's say for the external paper, parallel pathways, there's no need for them to take prerequisite exams. Okay. Any other questions?
Doktor.
Yes. Oh yeah, bang. Alright. Wakil pelajar.
Tak, doktor. Kan doktor cakap kan kita ada exam untuk pergi year seterusnya. Tapi kalau kita fail, kan kita ambil receipt exam. Contoh kita ambil receipt exam tu. Lepas tu kita fail lagi kan kita kena repeat satu year.
Yes.
So dan kita repeat tu berapa banyak kali boleh repeat.
Oh, okay.
Lepas tu setiap tahun tu kan kita ada apa dia punya program. Program tu kan doktor cakap di bawah yuran. Tapi kan kita repeat tu adakah masih di bawah yuran ataupun kita kena bayar sendiri?
Oh, okay. Okay, thank you. Right. Okay, the soalan actually was about the repeat exams. Okay, and how many years of repeat exam actually is allowed? right? Okay, the answer is actually if you were to go under the KPT ruling, the whole year of a studies MBBS no more than 7 years. No more than 7 years, meaning that for the preclinical year 1, year 2, you're only allowed to repeat one time. For clinical, you're only allowed to repeat one time. So 5 plus 1 plus 1 equals 7 years. So no other students can be allowed to sit this to take this MBBS program more than 7 years. So meaning that satu preclinical 1 tahun saja, okay, clinical 1 tahun saja. Okay, so meaning that if you were to fail your exams, make sure that you pass. So you don't have to repeat the whole year. Repeat the whole year satu kali, tahun depan tak boleh repeat year lagi sekali. Tapi kalau dah masuk year 3, year 4, year 5, boleh repeat lagi satu kali. So macam tu, right? Okay, mengenai pengajian tadi, yuran pengajian, kalau repeat, let's say contoh PT-PTN ataupun JPA bagi yuran pengajian up to 5 tahun saja, tapi now dah lebih. So yang 1 tahun tu kenalah keluar dari poket sendiri, unfortunately, right? Even actually kalau nak ambil exam pun repeat, kena bayar juga. I think satu paper about RM400 macam tu pun kena keluar daripada poket sendiri, unfortunately. Sebab JPA semua bagi according to 5 tahun, then you ada lebih tahun kan. So lebih tahun ni sila bayar sendiri, unfortunately. Okay, so tu je soalan. Yes, ada apa soalan lagi nak tanya? Sila tanya, boleh. Okay, so I think before I end this session, first of all, thank you very much for your attentive listening. Okay, and then I do hope and I want to see all of you actually to join the medical MBBS program here in university, and then we'll have a lot of fun and also a lot of joy, okay, to study for this program, right? So with that, thank you very much. Assalamualaikum warahmatullahi wabarakatuh, and thank you.
Terima kasih diucapkan kepada Dr. Hairel Anuar Selamat di atas perkongsian yang amat bermakna sebentar tadi, dan mungkin akan